any lab tests you're having done regularly and then keeping tabs on?
Again, I do some of this, not necessarily for my own health, just to kind of educate, because I kind of have a role of an educator now. And I think it's interesting to realize how dynamically variable a lot of things are. For instance, I wear a CGM from time to time. And generally, my blood glucose is generally pretty low. And most people would say low is better than high. There are some people that say, yeah, it's normal to have your blood glucose, you eat some blueberries and goes up 20 points, who cares, whatever. And I kind of tend to concur with that. But I've seen, like when I'm doing exercise, intense exercise, heavy deadlifts, hard sprinting, my blood glucose may pop up over 200 for a little while, not super long. But am I supposed to believe that that is pathologic, or is that a normal physiologic response? And for those people that are like, it's always got to be flat and it's always got to be 83 milligrams per deciliter, I'm like, well, there's day-to-day variance. We know, like, for instance, and certainly diabetics know this, and not that diabetics are necessarily displaying perfectly normal responses, but we know that, like, or I could say, but somebody's involved in a trauma in the hospital, post-surgery, we're going to see a stress response. We're going to see a stress hyperglycemia. That is physiologically appropriate in many cases. And the reason for is we know during some physiologic events, the body operates better in a higher glucose state. Sometimes, with stress hyperglycemia, there's some evidence that the immune system will do better in that particular situation with a higher glucose load. We know, for instance, if a bear is chasing me, I'd rather have high blood glucose than low blood glucose, because we want that energy so I can get away quicker, right? And so, like, for instance, when we go back to performance, like whenever I'm doing hard events, my blood glucose goes high because I produce it. I have plenty. I don't struggle because I'm not consuming a bunch of carbohydrates. I can still make it on demand because I'm so physiologically adapt to that over time. But yeah, I think like there are labs they're interesting. And I think, we've watched this evolve with the era of the CGM coming in. Before we had this, one-off, you could check blood glucose a few times a day with a finger stick, but we didn't have this continuous data. And so now we're seeing, wait a minute, you've got professional athletes who are the fittest people in the world walking around. I saw data on a triathlete. He spent 4 hours with a blood glucose over 400. Is that pathologic? Is it normal in that situation? We don't know. We're learning all these things. And the same thing as we get continuous ketone monitors, and we'll have continuous triglyceride monitors and insulin monitors and everything else. So we're learning all, we started, things like HRV when they came in, people can monitor these things all the time. And so we're seeing these things that we once assumed to mean this to turn out, no, it doesn't mean this. It depends on what's going on, throughout the day that affect these things. So I think we're going to have a significant, exponential growth in our data from all these people uploading their data to know what it actually means. Is it actually healthy, unhealthy? What it correlates to? Is it dependent upon this? And so my supposition is it's just going to have so many things impact these things. And so to go into a doctor's office once a year and get your blood test and assume every number in there is just what it always is completely, it's infantile to think that way. And so I think we have to get beyond that, and we have to really put things in context. And again, it probably comes down to, hey, how do you feel? I know it's subjective and hard to measure as it is for some people. It's probably the more important question.
Have you ever played around with one of those continuous ketone monitors or done finger pricks? And then under that, are ketones important for you when it comes to brain health, performance?
It's interesting. There's a lot of research going out there that ketosis, the act of being in ketosis has tremendous benefit for mental health. There's a wealth of data coming out there. Chris Ballmer, George Eade, and Jan Bazuki at the Metabolic Minds, I don't know what their institute or whatever they're calling it, are doing tremendous work in that regard. So I do think, and around cancer, there's some other sort of compelling data out there. I think ketosis is a beneficial state for a lot of reasons. I think how you get there is important too. I don't think just chugging a bunch of MCT oil or exogenous ketones is equivalent to, what it takes to produce it endogenously. So I think there's some differences in that. I check mine from time to time. So I've got monitors at the wazoo because people have sent me stuff over the years just because I have a big social media platform. Here, try this, try that. So I've got them stacked up. So every once in a while I get, let's try this and see what's happening. I personally don't ever typically see really high ketones on myself. I mean, I can, if I were to fast for a day or two and I could direct it now, but that's not how I normally live. I normally live, I eat every day, I work out. And part of that, and I think this is part of the thing, and in our company, Revero, we use ketones, we check ketones all the time. And I do think there's importance there. But I mean, at the end of the day, we have to realize that, when we're measuring ketones, whether it be in the blood, urine, or breath, it is generally a product of a couple things. How much ketones are you producing, but also how much are you utilizing? If you get more efficient at utilizing ketones from your brain, from your heart, from your muscles, you're just not going to display as much ketones sitting around. It's because we're very effective at using it. So, and we saw that. I think some of the Verta Health data that came out years ago when they first started looking at people that they were convinced on ketogenic diets, and Volek and Finney came out with this arbitrary diagnosis for nutritional ketosis. It was 0.5 millimolar. And they've come back and said, well, maybe it's like 0.3, because all of our data is showing these people with time, they get more efficient. And with the same exact inputs, now they're showing lower ketones. So I do think we just get better at utilizing them. So I don't really, again, I think it can be helpful, a useful tool early on. But I think if you're just always chasing ketones, unless you're maybe epileptic or you're, want a real high glucose ketone index for cancer or something like that, I think for the average person, because you can gain weight while producing ketones, and you can lose weight with not producing ketones. I mean, it's not the only thing that matters there. So I get less excited about that. But I mean, I think the continuous ketone monitor, which now exists, probably produces some interesting results. And again, it probably produces a lot of anxiety if your only metric is how high are my ketones, because you'd be like, oh my God, what did I do? I better not sleep because my ketones will be too low or something. I don't know, some craziness that comes there. You got to keep the goal. I think that's important. What is your goal? My goal is not to produce as high ketones as possible. My goal is to be healthy, lose weight, whatever, put my diabetes in remission. It's no longer have depression, something like that. So again, we have to realize we don't get lost, lose a forest for the trees.
It sounds like you haven't played with them yet, the continuous ketone monitors. Is that true?
No, I have not played with that. I've used just the standard typically blood ketone measures.
That utilization piece, really interesting and important. Over time, how our body is likely getting better at using those as fuel, and we might not see as many when we're testing. You, somebody that's been doing this for 10 years now, you mentioned now you're not producing that many ketones, but is that a trend you saw?
I'm not wasting as many. I think I'm still producing ketones. I just probably utilize them very rapidly as soon as they're producing. Yeah.
But when it comes to testing, the early days versus now, did you notice that trend where in the early days you were producing more?
I never really tested in the early days, so I can't say from me personally, but I do see it all the time, very frequently. I see people that'll start out, 2 weeks in, they're producing high ketones, and then 6 months later, like, oh, my ketones are only 0.2, 0.2. What am I doing wrong? I'm like, well, how do you feel? I feel great. Well, don't worry about it. All right. I mean, that's what I see.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
The last 9 years, I've probably consumed, without exaggeration, like 10,000 steaks. That was one of the things that struck me 10 years ago when I first went carnivore. It was like, I don't even know my digestive system's working because I don't feel anything. I have no perception of digestion.